Okay. Morning everybody. Tony Burns, and I'm the Senior Environmental Health Officer with Murrumbidgee Health. And look, today we've got to announce that we have 4 cases of COVID-19 reported to Murrumbidgee. They are located here in Wagga Wagga. It's a family consisting of a 52-year-old lady. She's got a son and daughter-in-law, and they're in their 20s, and they've got a young child. They've all been confirmed. They all are self-isolating. We're very comfortable with where they're isolating, and they are being followed up by Murrumbidgee with our virtual care and hospital at home to ensure that they get daily contact and are followed up to ensure that they have any issues they have concerns about are addressed. They have returned from Victoria and they have isolated since, so we're very confident that the isolation hasn't been in question and that anything at this stage has been addressed by our infectious disease team. There's no further follow-up of anybody else because it's a small family group and they have isolated totally amongst themselves. So yeah, we're very confident that there's nothing of concern to the general public at this stage.
So no contact tracing details?
No contact tracing needed. As I said, a small family group of 4, no contact tracing. They haven't travelled anywhere. They have returned from Victoria and they have self-isolated, and all the short period of time that it has been, they haven't been anywhere else. They have had, as needed, groceries delivered online, and they've done the right thing.
Where in Victoria were they?
Look, we haven't got specifically just to release today the details, but they have been down in the lower Melbourne area. But yes, they have, and they did get a travel permit to cross the border. So they were legally allowed, and they met the conditions on the permit. They were allowed to travel and cross the border.
And they're local to Wagga, just to confirm that? They live in Wagga?
Yes.
Yeah, so they were just visiting Melbourne and then returning home and...
Look, we haven't got specific details about why they were in Victoria, but we have the details that they were returning to Wagga, and that was obviously one of the conditions on the travel permit.
Do you know when they were in Melbourne and when they returned? What those dates?
It's only been in the last few days. The initial case was confirmed with us on the 28th of July, so it was just prior to that.
How old was the kid?
Oh, it's a young child, very young. But look, we're ensuring with medical care that that child is very specifically looked after as well.
A baby, young or toddler or?
A baby.
Baby. And the age, so a 52-year-old woman, and what were the ages of the other?
The other 2 are in their 20s.
In their 20s, and a man and a woman.
Man and woman.
And are they displaying quite strong symptoms, or is it kind of just like the equivalent of a cold?
Look, I might let Dr. Bruce direct that question for you if that's all right.
Sorry, just to confirm, was that a mother and 3 children, or what's the family group?
No, it's a lady in her 50s, her son, her daughter-in-law, and a granddaughter.
Okay.
All right. Thanks.
Good morning, everyone. So the good news is that the 52-year-old lady has got very, very mild symptoms, and she has been reviewed by our COVID physician and our hospital in the home team. And as far as we're aware, the other members of the family are completely asymptomatic at present. I can just add, so they've been in Wagga since the 25th, but they've been isolating since then, and then the test was on the 28th. So with our information, they have been isolating in the period where she may have been infectious. So that's really, really good news for us and for the community, and we should thank them for doing the right thing. I think that is such an important thing. It's not easy to isolate, but we need to thank them for doing the right thing. So once again, moving on from there, testing is essential. Once again, the mildest of mild symptoms, please present for testing. Call the COVID hotline. You can also contact the Commonwealth Clinic through the Hot Doc website, or contact your GP for testing. The plan is for us to increase our testing capability and doing some additional mobile testing clinics, and we're also in the process of establishing a drive-through facility, and we will provide you with more information as that becomes available. We've also added additional resourcing to our COVID hotline to ensure that they can manage all the extra calls. In terms of the management of the family, they've been admitted to our hospital in the home service or our virtual ward, where they will have regular review. Because we have a little one as part of the group, we have already liaised with our pediatric services as well to make sure that everybody in the family gets the care that they require. The other bit of additional information, I'm sure most of you would be aware of the new guidelines that have been provided in terms of masks, and that the wearings of masks will now be encouraged. It's not mandated, but we know that the wearing of masks can reduce transmission of COVID-19 by about 75%. So really the recommendations are, and they're reasonably strong recommendations, is that if you're in a position where you cannot physically distance effectively, wear a mask. If you're in a occupation where you get close or face a lot of members of the public every day, please wear your mask. If you go to a place of worship, wear a mask. So we've done such a great job in preventing COVID, so we really need to stick together and get those masks on. The most important thing with masks, though, is that they're in addition to all the other things we do. So once again, if you're unwell, stay at home and arrange testing. Make sure that you physically distance if you can, wash your hands regularly. So the masks will not replace all those other good things we've been doing in the meantime.
With masks, there've been, am I good to jump
No,
in?
feel free.
There's been a lot of different community people making their own masks,
Yeah.
but could you just clarify the guidelines on the 3 different layers of the masks and what sort of materials need to be used?
Yeah, so the best way is probably to go and look at the World Health Organization website. They actually tell you exactly how to make your mask. But if we go and look at that, even in Victoria, face coverings, so really if you cover your face, and they've given lots and lots of options. So go and have a look at the World Health Organization website, and they'll tell you exactly what to do if you want to wear the mask. The most important thing is to wear the mask appropriately, and I'm an anaesthetist by background, so I'm used to wearing a mask, but it's actually quite difficult not to touch the front of it, to make sure that you don't touch the front of the mask. Make sure that you wash your hands, or use hand sanitizer, and make sure that you wash your mask and make sure that it's dry too, that it remains clean. But that is something in addition that we can do to keep our community safe. So we would strongly encourage the community to follow the advice from the New South Wales Premier.
Has there been any sorts of concerns about shortage of masks in hospitals across the region, or any sort of PPE equipment?
No, so currently we are in a good position, and our essentially allocation has been increased to accommodate for the increase in usage of masks, because obviously it's been a little bit more than a week now where we've changed the requirements for masks in hospital. But as far as I'm aware, currently we have enough stocks of PPE, and it is something that is very closely monitored on a district and a statewide level.
The advice for people on the border, Len, obviously it's mandated over in Victoria. Do people in those border towns need to be, more strongly encouraged to wear them than other places?
Yeah, I think we know that it protects people. 75% reduction, I think, is really good. So it would make sense for people in those areas to wear masks, but really it makes sense for all of us to wear masks. The other bit of information that's really, really important is that we need to know when members of the public have been exposed. So in other words, if you go to a business, make sure that your details are there. And this is where the COVID Safe app will be so useful. Because the one time when we actually will test asymptomatic members of the public is if we've known they've been exposed. So if we look at this group, one family member was symptomatic, the other 3 have no symptoms. But now we've tested them, we know that they're positive, so we can firstly make sure that they stay safe, because once again, the majority of people have a very mild illness, but we can now keep a close eye on them. And it is important that we know and trace all the contacts. So we need the community to work with us, follow the rules, download the COVID Safe app. You know, I had my hair cut yesterday and I, had to put my name and phone number down there. But that's all those things that will keep all of us safe.
I know this family's self-isolating, but are you concerned that we'll see more cases here in Wagga?
We're always concerned. I would be very unpleasantly surprised if we have more cases in Wagga because of this particular outbreak with the information that we currently have. So I don't think there is any need for panic in the community at all. That family has been great. They've done the right thing. The systems that we've put in place has done exactly what it's designed to do. We picked the infection up early, isolation, tested contacts, so it's actually worked extremely well. But once again, we know that there has been some cases in New South Wales, and luckily we've been able to really control the number of new cases very well. But we still always have to be careful, and we are concerned about the possibility of new cases, and really that's why we are strongly recommending that the community wear masks when they cannot maintain physical distancing.
Is there any increased concern with the infant in terms of offering care at home? Does it make you think about sort of proactively admitting them to a hospital ward or something like that?
So, well, the first thing I discussed yesterday morning was actually with the COVID physician to get the paediatric team involved. The benefit is they manage children at home on a regular basis, and remember, children with other respiratory illnesses. So I'm very confident that we can look after them safely. And once again, if hospital admission is required, then we can do that quite comfortably.
Obviously, like, the identity of this family is confidential, but have there been any sorts of issues of stigmatisation or anything from members of the community, or is it kind of nobody really knows about it yet?
Well, they will know after we've done the media conference, but there should be no stigmatisation involved. It would be the same as being angry at somebody who's caught the common cold. So I don't think that would be fair, and they should be congratulated for doing the right thing. And we don't want people to be victimised or stigmatised because of this illness, because we want people to come forward for testing. Because unless we test, we will not be able to manage this condition appropriately.
Not that you want stigma, but if they return on the 25th, that's obviously well after the restrictions on heading to Melbourne. Were they in Melbourne for some time prior to that?
We're not sure, to be quite honest, but once again, they did the right thing. They applied for a permit and they self-isolated as per the requirement. So it doesn't mean that people cannot travel at all. It just means that you have to apply for a permit, and the most important thing is to comply with the conditions of the permit.
So we're not sure exactly when they went, but just sometime since the permit system was introduced.
Yes. Any other questions for myself or Tony?
All the hospitals along the border,
Yes.
obviously Victoria's numbers keep growing. Are you getting more concerned about the Victorian side of the border impacting those hospitals near there, and whether those hospitals are going to have enough resources?
The one good thing about the outbreak currently is that the numbers in regional Victoria is a very small percentage of the total cases in Victoria. But it is obviously of concern because there are some of the larger regional areas where there has been some cases. But we've been in communication with medical directors for the Victorian sites recently, and once again, when the initial outbreak in Victoria increased, we stepped up training for those sites and also making sure that there's processes in place to support them. So I'm confident that we can manage what we're presented with, and that's why planning is so important.
From me, thanks very much.
Thank you.